Hi, I'm Tracy Sprunger, Assistant Professor of Pharmacy Practice at Butler University and also the Director of our Residency and Fellowship programs that we offer here through Butler University. I help coordinate the longitudinal academic experiential program that we offer for our Butler-funded residents, in addition to all of the residents in the Indianapolis area who were invited to participate in the program. The goals of this longitudinal experiential program are to provide residents the opportunity to gain group facilitation skills, and we do this in our self-care course as well as our therapeutics-based, case-based course. In addition, other goals are to provide the residents an opportunity to mentor students and serve as primary preceptors for our experiential program, primarily for the P4 pharmacy students. Currently, we have 40 residents participating in our longitudinal program, 7 of which are Butler-funded residents and required to participate in the program, and then we have about 40 residents total who volunteer to participate. Residents are provided feedback via faculty mentors as well as by student feedback. So each resident is either paired with a faculty member or has a faculty mentor in which they complete a midpoint and a final assessment, which is in conjunction with ASHP goals and objectives for each different residency program, whether it be a PGY1 or a PGY2 year. Also, our students are provided a small evaluation tool that they use at the end to give feedback for the residents, in which they use for their teaching portfolio at the end of the year.
I'm Katie Axford. I'm an assistant professor of pharmacy practice at Ferris State University College of Pharmacy with a clinical practice site at St. Mary's Healthcare in Grand Rapids, Michigan. As faculty on site, we offer our residents an academic rotation where they can participate in the full academic experience, starting with calendar development and topic discussions to students, all the way through attending faculty meetings and committee work on campus. On a larger scale, Ferris State University organizes a teaching and learning certificate program to allow residents the opportunity to participate in a lecture series with pharmacy faculty to discuss important concepts and skills for teaching in pharmacy education, as well as opportunities for didactic lecturing, as well as additional precepting opportunities for students in our pharmacy program.
My name is Sarah Nisly, and I'm an assistant professor within the Department of Pharmacy Practice here at Butler University. I also have a clinical practice site at Methodist Hospital in downtown Indianapolis, and I currently serve as the program director for the 2-year pharmacotherapy program that's a joint effort between Butler University and Indiana University Health.
And I'm Tracy Costello. I am an assistant professor in the Department of Pharmacy Practice as well at Butler University. My practice site is at Community Hospital East with the Family Medicine Inpatient Program, and I am the PGY2 Pharmacotherapy Program Director, which is a joint effort between Butler University and Community Health Network. Dr. Nisly and I have very similar programs. Some differences, just to point out, is I have solely a PGY2 program, where hers is a 2-year pharmacotherapy program. Additionally, some things we have similar is we do have a teaching focus for our pharmacotherapy residents. The first thing that are similar between our programs is that our residents will be involved in the case conference teaching at Butler University. So this is a small group facilitation, whereas PGY1s in Dr. Nisly's program, they will be a co-faculty member and get mentorship from a faculty member or PGY2. Whereas in the second year of their residency, they get to be that faculty preceptor in the room, provide feedback to the PGY1 residents, as well as students on their feedback throughout the semester.
The additional component that we have in common is our efforts in precepting, and this includes our residents being involved in the introductory pharmacy practice experience, or IPP hours, that they have to have, as well as involvement in their APPE rotation experiences. Our residents serve as pharmacy student preceptors, as well as my resident also serves as a PGY1 preceptor during their second year of residency.
Some things that we require of our pharmacotherapy residents to be prepared to be teachers, to precept in the experiential avenues or in the small group is through Butler University and Purdue University, there is the Indiana Pharmacy Resident Teaching Certificate Program, which is a longitudinal program that requires the residents to listen to didactic lectures in a concentrated 2 days, followed by different requirements throughout their year, including small case facilitation, experiential teaching, as well as didactic teaching to different levels of learners.
Our didactic experiences are one of the key things that I think sets our programs out from other programs nationwide. We have offered several different experiences to several different levels of learners to help our residents get the best rounded experience for their time with us.
I'm Meny, Assistant Professor of Pharmacy Practice with Ferris State University College of Pharmacy and Residency Program Director for 2 Ferris affiliated programs, one with Spartan Stores and one with Pharmacy Group Practice Associates. At Ferris State, we have 4 community pharmacy positions with 3 affiliated residencies that we use in a couple different ways. One, to do community pharmacy workshops. We pull all of our students who are doing their advanced community experience in their P4 year, and the residents serve to facilitate student learning in the areas of over-the-counter medications, pharmacy law review, some different community practice issues, and really take ownership of those activities, as well as providing direct preceptorship to our students at their practice sites individually. And they also do a little bit of help with us in the area of experiential learning and helping to make sure our curriculum is meeting the needs of our pharmacy students.
My name is Eliza D, and I am the PGY2 Pharmacotherapy resident, co-funded with Butler University. So I knew going into residency that academia was something that I was interested in and something that I wanted to pursue further. So I took part in the teaching certificate program here in Indianapolis. It really gave me a lot of opportunities to practice teaching and kind of put myself in that setting, as well as get some good mentorship. It really solidified my decision to pursue a faculty position. But also I think all of my experiences here at Butler have really prepared me to step into a faculty position. So I have successfully obtained a faculty position at another school of pharmacy. I think some of the most helpful experiences for me and my future career have been, first of all, the small group facilitation with our weekly case conference class that I've participated in all 4 semesters of my residency. I've also been given a lot of opportunities to participate in large group didactic lectures, which has been very helpful to build those skills as well. It's a very different skill set. In the experiential setting, I've had a lot of experience with students on rotation and have served as a primary preceptor for those students as well. Additionally, we're encouraged to participate in additional activities such as precepting students through the research process, so I've been a research mentor this year as well.
Hi, I'm Alison Walton. I'm an assistant professor of pharmacy practice at Butler University and a clinical pharmacy specialist in ambulatory care at St. Vincent Health. One of my roles with the program here is in incorporating our non-university funded residents into teaching experiences. I've worked with our residents on the site to include them in all of our activities, even though we're not a funded program. One of the areas that we include these residents is teaching with case conference and facilitating in our small group discussion. Other areas is including our residents in teaching in elective experiences. So we work with other faculty in the department and include our residents either lecturing or facilitating in their elective experiences, as well as even up to co-coordinating those experiences. I've worked with our residents to have them involved in various volunteer service opportunities throughout the university. For example, they help with health screening events. They might also then work with our low-income, underserved clinics throughout the area and volunteer to serve as preceptors for those students. In addition, our residents help often to serve as co-preceptors on student PharmD research projects. They might serve as an evaluator and a reviewer of these projects during poster presentations and other podium presentations. Of course, our residents are always involved in co-precepting students at the site, and they facilitate topic discussions as well as serving in that preceptor and direct patient care opportunities. What have you done to incorporate your residents into teaching experiences, both on your site as well as at the university level? Be sure as you're thinking this next year, what is one opportunity that I could incorporate my residents from my site into experiences teaching on campus?